Hi, I'd like to introduce myself. I'm Sue Palmer, veterinary physiotherapist, ACPAC Category A. I'm an Intelligent Horsemanship Recommended Associate, a BHSAI and an equine body worker. The title of this short piece of video is Brain or Pain, and what I'd like to talk to you about is the link between physical pain in your horse and either behavioural issues or your horse not reaching his full potential. I want to give you some tips on how to look for pain in your horse, help you to know where to find a professional to help, and talk to you about the Horse Owner's Massage course, where you can learn to help keep your own horse in tip-top condition. When I talk about your horse not reaching his full potential, I don't mean that he can't jump a 4-foot course or can't do a Grand Prix dressage test. It might be that he's a happy hacker who's started bucking. It might be that he's difficult to load. It might be that struggling to pick his feet out, or you're having problems with the farrier. Or it could go as far as the dressage horse that's struggling to do left canter half pass. There's lots of reasons that you might get a problem with your horse, or that he might not be reaching his full potential. These reasons can be purely behavioural, and in that case, an Intelligent Horsemanship Recommended Associate will be able to help. They could be rider or handler related, and again, an Intelligent Horsemanship Recommended Associate can help with that. They might be saddle related, they might be teeth related, foot related, or they might be musculoskeletal, so they might be tension or tenderness. There's specialists to help with all of these things. So you've got saddlers, dentists, vets, trimmers, farriers, and of course physios. Musculoskeletal pain is pain relating to muscles, tendons, ligaments, bones, joints, or other tissues within the body. So to put all of this in context, I'd like to tell you about a couple of horses that I've worked with. One was a horse that had problems picking his feet up. When I visited him, I felt that the issue wasn't purely behavioural. We got the vet involved and he turned out to have arthritis. It wasn't that he was being awkward about picking his feet up, it was that it hurt him to do so. Another horse I visited, the owner was having problems getting on. They'd owned him 2 months before I met him and had only actually been able to get on twice in that 2 months. Doing a behavioural assessment and a physical assessment, I decided that there were elements of both causing the problem, and also the owners had recently ordered him a new saddle because we felt that his saddle was also causing an issue. Once the saddle was fixed, the physio was done, and we did some behavioural work as well. They're now hacking out happily together. So through some of these examples, you can see that you can't always take at face value what you see or what you hear. That sometimes issues are pain related and sometimes issues are brain related. And hopefully that helps you to realise how important it is to call the right professional to be able to help you reach the right conclusion for the best performance for your horse. So you can see that there are a wide variety of issues that can cause your horse to either have a behavioural issue or not to reach his full potential. My theory is that the more comfortable your horse is, the better that he'll work for you. The better that he works for you, the more that you'll praise him. The more that you praise him, the better he's going to want to work for you. So you've got this continual cycle of improvement where your horse's work becomes better and better, and it all begins with making sure that your horse is comfortable and pain-free. So what I'm going to do now is run you through what I might do if I visited you and your horse at your yard for a physio assessment.